Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras, A Changing America. I'm Anthony Morneau. Today we learn more about research on how COVID-19 has impacted health and health-related behavior. Joining us is Dr. Jagdish Khubchandani, a professor of public health at New Mexico State University. Jagdish, welcome back to the program.
Well, thank you for having me.
Well, it's great to talk with you again. We're going to be talking about COVID-19 hesitancy. You've done a lot of research in this field. Let's start off with the research that you've been doing with healthcare professionals, specifically nurses and dentists. You did a worldwide study on this. Can you share with us how many folks you were able to talk to and what is really the basis of this study?
Yeah, so we have been tracking vaccine hesitancy since June 2020, when the vaccines were not even out in the market. And we started with the general American public. We sent out hundreds and hundreds of questionnaires nationwide. Then we picked on special populations such as racial ethnic minorities. And after that, we thought we should focus on more special populations like healthcare workers worldwide. So we collect data from individuals, mass media reports, governments, authorities, and put all the data in one file and see how many people are vaccinated or not in the healthcare workforce. In the latest study, we find that almost a fifth, 20 to 25% nurses and dentists are not still vaccinated and don't want the vaccine. And unfortunately, many of these individuals are not being tracked despite the mandates in some countries. There's no way to track dentists and nurses on how many of them are vaccinated or not. So that remains a big point of concern, that here we have a raging pandemic and yet healthcare workers are hesitant. And what's interesting is the concerns are similar to the concerns of the general population.
Wow. So let's break them up. With nurses, what were the findings?
So, worldwide nurses, we found that most of the reports come from nurses who are women, and the profession is dominated by females. Almost 20 to 25% of them are not willing to take the vaccine, and their biggest concerns are fear, side effects, concerns about the efficacy of the vaccine. Is it really helpful? And then they have, special types of concerns like, will I become infertile, or will I have a baby after this vaccine? What if I die after taking the vaccine? Who will take care of my family? So worldwide, a female-dominated profession on the front lines has these concerns that have not been addressed properly.
Now with dentists, what were you finding?
Dentists, again, they are in various countries almost exempt from being tracked or being a part of a mandate because they practice in the communities. And so they have been like, either I don't have the time, either I don't have the access to vaccines. I'm not a part of a big hospital system where we have daily access to vaccines. And I'm also concerned about my health and well-being. And yet majority of them continue to see patients. Almost 20 to 25% still need the vaccine or don't have the vaccination.
I see. Now this has to be concerning for some folks, considering how you have nurses, you have dentists who are working up close and with patients who may be concerned about contracting COVID-19. I mean, there's been a lot of information out there about how people have put off healthcare visits because they're worried about visiting places where they might contract the virus. So with these findings, what were some things that you found were major reasons why people were not getting vaccinated? You mentioned that they are very concerned about the side effects. You mentioned that the women that you surveyed were concerned about it impacting pregnancy. So when you hear these things from the people you surveyed, what does that show? What does that highlight perhaps the problem it may be?
I think the foundation is that we tend to believe that just because someone is a nurse or a doctor, their health behaviors are better. But no, they're a part of the general society. So they get a lot of influence from families and the society. I could be a healthcare worker 9 hours a day, but when I go home, I see the news, I see the social media, I listen to my family, and that's a big influence. So whatever the general American people or general Asian people think about vaccines is the same as what the dentists and nurses are thinking. That I don't know if this vaccine works, is it safe, is it efficacious, and will there be too many side effects that I'll not be able to deal with? And think about, someone is a nurse, how much sick time can they get if they fall sick, if they have this vaccine? So it's almost like we overestimated the healthcare workers' knowledge and beliefs, but they're similar to our general population. They're human beings who have the same concerns as all of us have.
Now, vaccine hesitancy has been an issue across the world for a while. I believe last time we talked, you mentioned that the World Health Organization listed it as one of the top concerns for public health across the globe was vaccine hesitancy. That was before the pandemic really hit. So what are some things that you've noticed that some countries have had success with when it comes to addressing vaccine hesitancy?
Yeah, I think so. Many of the countries have had tremendous amount of effort invested in controlling the information flow, educating people, having community-based initiatives to vaccinate people, and also give people time to think, reflect, address their concerns, engage local role models, celebrities, the local radio and media. I think that's where some Western countries have failed. We went from here's a vaccine to here's a mandate in 9 months without investing time and effort in the communities, engaging local role models and leaders. And I think that's hurting us now.
Well, right now we're at a time where folks are getting booster shots against COVID-19, and there's even talk about more perhaps on the way. We don't know what's going to happen there as of this moment. But when you have a situation where we have these new variants, we have Omicron and we have the subvariant with Omicron, with that BA2, people who thought they did the right thing by getting vaccinated and getting boosted, we're still contracting the virus. So how does that affect the messaging when you're trying to get people to get vaccinated and boosted?
Yeah, I think there's, as I've said earlier when we talked, that global health crises are also information and communication crises. I don't know how we got to the message where people trying to understand that vaccines will not cause infections. You still have infections after the vaccines. There are many cases in many vaccines. The idea of a vaccine is to prevent serious illness, hospitalization, and death. So I think from the beginning we have this wrong messaging going on. It was just inappropriate to say once you are vaccinated, you are a free bird, you can do whatever. No, we are in a pandemic where the virus evolves. Vaccines are supposed to protect against severe illness. And in the future, you may need more vaccines because immunity dwindles over time. So I think we have not been thinking ahead. There has been lack of foresight and there's been communication crisis. Even today, with all the vaccines we have, they hold good against Delta, Omicron, BA2, you name the variant, and being vaccinated offers some level of protection. Study after study. I think the problem here is poor messaging.
I see. Now, also with the vaccine, you have a lot of concern about vaccine equity and how it's being dispersed across the country. You were able to look into this issue. So can you kind of share with us some of the things that you're able to find out with vaccine hesitancy in Hispanics and African Americans?
Yeah, so I think since the beginning of the pandemic, the two groups that have been most highly affected, high rate of infections, higher amount of deaths, is Hispanics and African Americans. And unfortunately, those are the communities where the initial rollout of the vaccines was not adequate. So one of our studies was actually cited by the US Department of Health, saying that there's a prohibition on discrimination on vaccine allocation. All kinds of vaccines should be allocated strategically across communities without thinking about racial, ethnic populations or discriminating against them. So now that we have more access, the fact that they did not have access earlier may create some amount of mistrust. And even today, I think there's globally, if you look at Omicron is a classic case. We were all celebrating last year that we are up close to the end of the pandemic, and Africa had the lowest amount of vaccination available. And there's where we have the Omicron variant coming from. So now it's, I don't have to think of myself, but I have to think globally. Unless we vaccinate a huge population of the world, we'll have these periodic variants coming out from everywhere.
So with what you're looking at right now, I mean, with vaccine equity, what are some things you got to really examine when you talk about vaccine equity? Just thinking about the social aspect, how can we better understand that?
So, just for an example, I live in rural New Mexico. This place does not have a lot of health departments, a lot of mobile clinics, a lot of health centers. So clearly, I'm at a disadvantage because of where I live. There's no health center or a big bunch of stores that can have vaccines. So, given that I am poor, rural, and in a certain racial group, and in a certain geography, puts me at a disadvantage for getting the vaccines. The same would apply for testing. All the big cities, big metros, affluent neighborhoods have enough testing facilities. But then you move to rural Texas, rural New Mexico, where there's a lot of poverty, no health centers. How could I get testing? So it becomes an issue of pre-pandemic problems worsening in the pandemic.
Now, another thing to consider, I guess, with this is the political aspect. What are some things that you were finding with that that may be impacting folks getting vaccinated?
I think that the political aspect is not unique to United States. As we continue our studies, we find it in India, we find it in China, we find it in other parts of the world, that there's some amount of, political inclination of people that drives their belief to get a vaccine or not. So, the leading parties in every country, the sitting governments have this challenge. Any member of the opposition would say, I don't know if I should take the vaccine. And then their followers would get to the same message and stop taking vaccines. So in the United States, education and political affiliation are probably the two strongest predictors of whether someone would have a vaccine or not. And it's shown across our studies consistently worldwide. Having lower education or a conservative belief or mistrust in science and government is a strong predictor of vaccine hesitancy.
What about the economic factor when it comes to all this with vaccine hesitancy? Some things to consider with that.
Yeah, and so, economic factors are especially affecting the low-income countries where people don't have transportation, time to go get a vaccine. Like in the United States, many nurses we studied said, I don't have a sick leave. Many frontline workers don't get a day off. And so in some countries, when you especially ask for people to pay for a vaccine, it becomes even more difficult. Like in some parts of Asia, you can go in the private hospital, pay and get a vaccine. And whereas in some countries, it's free, sponsored by the government. But still, if you have to go 35 miles to get a vaccine, that's too much of a burden. And that we have seen with testing too. When we had a testing shortage earlier this year, people were traveling 30, 40, 50 miles to get tested. From New Mexico to Texas or within New Mexico going to bigger towns. And I think those are barriers we never thought about. It never anticipated, and it's just been poor messaging, poor preparation.
So what about some recommendations on really how you can address that poor messaging and equity when it comes to getting vaccine and COVID-19 information and testing to, to really address all of these factors?
So I think, in my view, when I look at my textbooks on how I was trained, I was told that community health starts with the community. So we have all these, COVID response panels and big team of experts. Sometimes we may not have adequate touch with reality. So my suggestion is first go to the people where the problem or the solution starts. Engage communities. Number two, in your list of experts, always engage a community leader, role model, celebrity, government official, policymakers, and above all, if you don't know how to do it, engage the media because it's their job to teach us marketing. I've taken health communication courses taught by media personnel because that was their field of expertise. So I think that's where we have failed to build a sense of a community, start where the problems and solutions are, and engage a diverse group of stakeholders.
Now, I want to get back to really the national response to this. Obviously, we're at a time where a lot of states have removed, well, pretty much every state has removed their mask mandate for indoor spaces, public indoor spaces. And kids are back in school. So it's kind of like there's this movement to keep things opening back up. We're at a time where, I've heard it, I'm sure you may have already, where folks are saying the pandemic's over. We're done with that. We're moved past it. I'm really not trying to hear about it anymore. I want to continue. I got to live my life. So what are some recommendations, with the data you're coming across that you can give policymakers to consider when it comes to addressing COVID-19?
Yeah, I think there's, for the end of the pandemic, I have described it as we have three types of ends of pandemic. One is the scientific end, when this COVID-19 becomes like a seasonal flu. That's the scientific end of this pandemic. Then we have a social end, that people are just tired and they don't care anymore. And the third type of end to the pandemic is a political end, that we just start celebrating because policymakers tell us to celebrate, that now we are all free birds. I think that we have to reflect as a society. Within the next 48 hours, through this weekend, 1,000 Americans will lose their life, and almost 50,000 will be infected. Is that what we would call the end of the pandemic? And how did we normalize this mass death event? So I think that's one thing to consider. And number two, I think with the policymakers and government agencies, you send me a mask, and within 2 weeks, you tell me that the mask mandate is over. You no longer need a mask. I really went to a store and got my free mask from the government. And 2 weeks later, I was told there's no mask mandate. So I think they have to reflect, anticipate, foresee problems, and not just jump into this cycle of continuous guidelines, changing practices. Because as of today, people have lost faith in all these government agencies. When you have these flip-flops within every week or 2 weeks or a month, and they should avoid this, look in the future. Sometimes when you have a guideline, just leave it where it is for some time. You don't have to revise it, change it, continue to communicate about it, because more communication is causing confusion.
Now, with this kind of issue, I guess we have to look at what if the pandemic takes a turn for the worse and a new variant shows to be highly contagious and dangerous, and then policymakers and governments are faced at this moment where they got to implement restrictions, public health restrictions again. What are your concerns about this? Should something like that happen, and what should policymakers consider should something like that happen to have the best success?
Yeah, I think they have to realize that while their motivation is to make people free again as soon as possible, but when they have to backtrack, people actually start losing faith in them. I think I would trust most Americans and people worldwide to believe that masks can help, vaccines can help, but when they get these confusing guidelines, I think that's where they get upset and they start doing random things that are not in alignment with science. So during the last July 4th, there was an announcement that we'll celebrate Independence Day. I don't know what was the thought process behind that. How did they assume that we'll achieve herd immunity and 100% vaccinated Americans will go out and celebrate? We never achieved those levels. So that was one. And this mask mandate removal, again, they had to anticipate worldwide. There's a new variant coming up now. BA2, United Kingdom, Singapore, Japan, Vietnam, the hospitalizations are skyrocketing again. As of today in the United States, 33% new cases are the new BA2 variant. And so we are in this phase of an evolving pandemic, and prevention is better than cure, as these things have to be kept in mind, that there will not be one more variant, there will be two more variants. And how do we deal with it?
So one thing we haven't really talked about when it comes to vaccine hesitancy is the issue about pharmaceutical companies and how there is distrust for them by some Americans throughout the country, especially when you look at how many folks have been impacted by the opioid crisis in our country. So how do you communicate the need to get vaccinated with people who may have family members who have lost their lives due to opioids in this country that were prescribed to them?
Yeah, and I think that's a difficult balance to maintain and create, and difficult communication. The tail is left, the body is gone now, as we say. So as of today, we have almost 70% Americans vaccinated. The other 30% have concerns about many, many things, not just the pharma companies. And we have to get back to those communities, do some assessment of what people want, what are they thinking. It could be mistrust in the political parties, pharmaceutical companies, healthcare providers. And so it has to be localized, culturally competent, evidence-based strategies. And yes, people have to know that pharmaceutical companies' mistrust is a worldwide issue. But are they giving the vaccines to you free? Yes. Can you read the info about the vaccines? Yes. And I think the channel between the pharma companies and public, it was probably the job of our policymakers to convey the info about those clinical trials. Like Pfizer had 40,000 plus people in their first clinical trial. How many were white, non-white, old, young, pregnant, not? That information was never relayed to the public. And it was like, okay, this big pharma giant has thrown out a vaccine, take it. So I think the company did its job to make the vaccine. It was somewhere between where the communication was to be improved. And the fact that it's free of charge, it has stood multiple trials and has been found to be efficacious, is what the message has to go to the people. And those pharma companies that were sued for opioid epidemic are not the ones manufacturing this vaccine. So there are some clear differences where we need to have more nuanced communication.
Now, when it comes to getting to the communities that weren't vaccinated or aren't at the level where they should be to help address this pandemic, what is working? I mean, is there any examples to where there was a community at the beginning of the vaccine rollout that was hesitant against the vaccine, but something happened with the communication or other factors to really get folks vaccinated?
Yeah, and there are good examples worldwide. Here in the border area, we pick up the Indian Health Service as a classic example of how the leaders went into the communities, met with the tribal leaders. They made it a community movement. They still continue to wear a lot of masks. They have high vaccination rates. As someone who studies public health, I'm amazed to see how high the vaccination rate of Native American people is around this area. And that credit goes to the people in the community, their tribal leaders, and the government funding that went to address these vaccine hesitancy issues. So really, it was a community-built movement.
Now,
there was no interference from the state or the federal agencies.
You mentioned government funding. There's still a lot of concern right now that there might not be government funding in the future to where perhaps it needs to be to address the pandemic. Congress seems to still be trying to figure that issue out. What are your thoughts on that, and what policymakers need to consider if they're not including funding against the pandemic?
Yeah, I think the congressmen, especially from the places where there have been more deaths, like in the border area, we lost a lot of caregivers in Texas, New Mexico, Arizona. We had the highest nationwide rate of losing a caregiver for a young child due to COVID-19. And the congressmen in these areas I would hope, urge the Biden administration to continue investing in testing, vaccination sites, and isolating people or addressing the needs of the people in the community. I think it would be a reversal of all the achievements and going back to a massive area of failure if we don't continue to fund these initiatives. And we have a classic example of Taiwan. Even before the pandemic, the amount of infrastructure and testing they created is unbelievable. They continue to invest in that. The fact that we knew about Omicron variant coming from Africa is because of their testing capacity, because they have suffered so much from HIV. And within days, they were able to notify us that they have a new variant. And here in the United States, we're thinking about shrinking the funding that just doesn't seem to align with good public health practice or a good policy practice.
Now, you mentioned young people being affected because they've lost a caregiver to COVID-19. We've seen data out there that could be estimates around 200,000 children who may be impacted by losing a parent or caregiver due to COVID-19. From a public health standpoint, how does that impact a community?
I think this is a generational problem. It doesn't affect this generation, it continues to affect a generation after generation. Think about, we had this unfortunate event in the 911 scenario. Some of those workers who are alive, firefighters, are still suffering from cancers. The Vietnam War. We have veterans living around in these communities in New Mexico who have cancers now. And so these kids have this disadvantage from early childhood. Now there will be challenges with their health, well-being, their employment potential. As we look at nationwide children who are born in poverty, they're gifted with this disadvantage that continues for a lifetime and maybe another generation. So urgent, decisive policy action is needed to address poverty, health, and social issues of these children. How do you support them, especially
Okay.
here in New Mexico and Texas?
Well, we just have a minute left on the program, but I'd like to hear from you moving forward with the data that you presented and have been researching. What are some things that are really standing out to you that people need to know about when it comes to this pandemic right now?
I think so. We have to be mindful about the new variants coming from unvaccinated countries where there's high rate of unvaccinated people, number one. Number two, in United States, you have to calculate your own risk tolerance and see how vulnerable you are. We still have 1,000 people dying every 2 days, 25,000 new cases every day, and close to 1 million people being dead. So really, there's no way we could justify that the pandemic is over. And as soon as you go into vulnerable places, or if you notice your community has a high uptick of cases, continue to engage in preventive behaviors and seek more information about vaccines. It's something that I do before I get vaccinated. I get all the info. You should do that too.
Dr. Jagdish Khubchandani is a public health professor at New Mexico State University. Thank you so much for joining us.
Thank you.
And we want to thank you for joining us for another episode of Fronteras, A Changing America. I'm Anthony Murnau. We'll see you next time.